If we just slouch just a little bit, we're slowing or stopping our lymphatic. Right, there you go. That's my goal, is to get people to just sit up straighter and don't get, scared off by these names. Just think of it as a zombie cell. We all know about zombie games and, these things that are alive, but they're really not alive. So a zombie senescent cell is a cell that no longer replicates. We get in an inflammation loop. So we have to get the lymphatic system flowing to get rid of these senescent cells, not all of them, but get rid of the buildup of them. And then we start feeling better, right? We start feeling more normal, because most women say, I just don't feel like myself. It's just an edge, right, of not having anxiety, not having depression, maybe not getting cancer, because disease has been found to be from lymphatic dysfunction, which is an obstruction, and we can open it up with the three things that I just talked about.
Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. There's a system in your body that affects your anxiety, your brain fog, your digestion, even your menopause symptoms, and almost no one is talking about it. John Ossipinsky, known as a Lymph Man, has spent over 3 decades working with the lymphatic system, the body's waste removal network most people were never taught to think about. He's a certified lymphedema therapist with advanced training in craniosacral therapy, visceral manipulation, and trauma work. What makes John's approach different is where he traces problems back to. Anxiety, brain fog, even stubborn digestive issues can lead back to a lymphatic system that isn't clearing waste the way it should. Before this became his life's work, John was an Army medic and a New York City firefighter, which probably explains why he doesn't shy away from a hard conversation about what's actually happening in the body. Please welcome to the show, John Ossipinsky.
Hi, Dr. Ellis. How are you today?
I'm good, thanks. My network might be struggling a little bit, but I think we're going to be okay. First, let's start off this conversation. I'm super excited about it. The lymphatic system is something that I talk about a lot and practice myself. So let's talk a little bit more about how you got into this work.
Yeah, I was, I retired from the fire department. I'm a person who likes to help people. I got bored. I went to massage therapy school and then learned from 3 world-renowned doctors. Dr. Upledger, craniosacral therapy, which is work for your brain and spinal cord. And then Dr. Burrell, which is visceral manipulation, how to move the organs. Our organs, when they can't move well, they sort of just don't function. And then really what moved me the most was Dr. Chickley on lymph drainage therapy. And all of these doctors, I didn't just take one course. I always went through advanced and got certified. And with Dr. Chickley, I followed him around for many years. And the lymphatic system is something that every single one of us needs to understand. I had a revelation about 7 years into my practice of, I didn't just work with swelling, which most people think of the lymph system for swelling or cancer. I worked with that, but I specialize in the brain. So because I had the craniosacral therapy training before, I brought the lymph and the brain together, and I found a lymph-brain connection, which now we'll talk about in a little while. They found in 2015. And I realized this in 2006. I published an Undetected Acid-Alkaline Imbalance. It's a book that really explains how when we become acidic in our body, and we treat acid as a digestive issue rather than something that's destroying every part of our body. And when we're acidic, it slows or stops this tiny network of vessels and nodes that every single one of us has, but we just don't talk about it. We don't even think about it for most people until we get a diagnosis of cancer, or unless they go see you, right? Because then they'll learn about their lymphatic system. But to me, I've been on a crazy path. I realized about 7 years into my practice that disease begins with lymphatic dysfunction. I had a revelation, and I started contacting the government and Surgeon Generals and everybody, and of course I was not well received. and now we know today, even though I wrote this 20 years ago, that disease begins with lymphatic dysfunction. NIH now, and I'm going to read what NIH found. In 2023, they did a report, The Emerging Importance of Lymphatics in Health and Disease. changes in normal lymphatic function can alter multiple systems in the body and manifest as different and varied pathologies. There are many conditions related to lymphatic dysfunction within all body systems. And when you read that, you have to understand that means disease begins with lymphatic dysfunction. So even though they just found this, it'll be 20 or 30 years before we really get this to the public. So my goal has been for 20 years to educate people, and it's working, right? I have people all around the world, but it's a simple system. Most people don't realize that we can gain control over it, right? Most people think of the lymph system and they think of, oh, okay, chemo, radiation, maybe some IV drips, more naturopathic stuff, the immunology, but it's really something that it's what we do every day for our lymphatic system that can make a difference. It's our body's sewage treatment system, and perfect for you. Its major lymph vessels are right here by your clavicles, by your collarbone. And what's the first organ I believe it affects? Your thyroid, right? Because it's so close to the major lymph vessels. So that's why I teach how to open up this area a lot, and we'll go over that later too. We're going to get people flowing as they listen to this.
Well, yeah. Well, let's start with the basics. Like, what is the lymphatic system actually doing, and why does really nobody talk about it? This might be a new system that one has not heard of before.
Yeah, Dr. Oz actually in the year 2000 wrote that the lymphatics are the next frontier of discovery in health and disease. That was in the year 2000. And I can tell you today, now we know for sure it is. There's no doubting. And I believe the biggest reason is because, we can x-ray the body, we can do MRIs, we can see things in the body. But up to about 15 years ago, we could never see the lymphatic system. We can never see flow through the body. But all that changed. Now we can see, you can go on to YouTube and put MRI or see lymph flow, and you'll see images of people just moving their fingers and they can move lymph flow. So a lot has changed. Even in 2015, they found lymphatic vessels in the brain. And to me, that was supposed to be a big thing and change world health. And we haven't heard much about it. But, our brain is dependent on our lymphatic system, and that might be why we have so much anxiety. And not just in adults, even in young children, we're having a lot of anxiety. So I believe this lymph-brain connection that I understand really helps everything, right? The lymphatic system helps most problems. And it's not about curing. It's more about, getting your body to work well, and it's not. So the system is basically like a plumbing system in your house. It has 1/4-inch pipes, 1/2-inch pipes, 3/4-inch pipes, and then your big pipes like the thoracic duct. But most of our vessels are microscopic or very tiny. And that's where we get little problems. That's where we get little blockages of fat and a buildup of waste. And then, just like NIH says, a dysfunction. And to me, that dysfunction of the lymphatic system is an obstruction. So we can gain control over those obstructions by deep breathing, moving our shoulders, doing a little bit of exercise every day, and of course some supplements. I believe we need some supplements to get our body working better. But it's just a tiny network of vessels and nodes that start in your toe, your calf, your brain, your eye. It's not like a loop, it's a one-way river, and it can get blocked anywhere along that. And it goes sometimes into lymph nodes, sometimes it goes into veins, and sometimes, most of the times, it has to end up in our neck, right here. And one tiny vessel, like an angel hair pasta, I'm part Italian, so it's just a very tiny vessel. And think about it, thousands of lymph vessels and hundreds of lymph nodes have to flow into those vessels. One little vessel on the sides of your neck. How many of your listeners have tight shoulders, tight neck? How many slouch? If we just slouch just a little bit, we're slowing or stopping our lymphatic. Right, there you go. That's my goal, is to get people to just sit up straighter. It's funny, me and my wife, I used to work in my office. Since COVID, I stopped seeing people. I mostly just coach people. And I'll be at my desk, and she'll just walk by and look at me, and I'll see her, and she'll straighten up, and I'll straighten up. So that's a little tip. You see anybody slouching, you straighten up, they'll straighten up. But don't that feel different? As soon as we straighten up our body, we feel flow. We feel lighter in our body because we have this whole secondary system that must flow, and truthfully, it's not for most people. And then our lymph system, instead of finding a strong route to the major lymph vessels, they find alternative routes which may not be as effective. So it's just a plumbing system that has to flow, and the most important thing is to remember that this is the major lymph vessel. So posture is one of the most important things that we can all do to get this system flowing.
Dive in a little bit more to the lymph-brain connection. You touched on it, like you think that's how or why we have so much anxiety, brain fog, maybe attention deficit. So can you speak a little bit more on that connection?
Yeah, we have to be careful what we say, right? Because there's no proof of that yet.
True.
But I will tell you, so I'm very careful. So we have to understand that in 2024, a research article came out on how brain acidity is linked to multiple neurological diseases. They listed many of them, from anxiety, depression, bipolar, seizures, headaches, migraines, Alzheimer's, autism, and acidity, right? We don't think of acid in our brain, but when our brain becomes acidic, your lymph system can't clean the glymphatic system. And most people don't know that our brain has its own little cleaning system called the glymphatic system. It was found in 2012, I believe. And it's just another, to me, pre-lymphatic network to pull waste out of the brain and into the lymphatic vessels around the membranes that surround the brain, the meninges. They just found them in 2015, lymphatic vessels in the brain. So before that, they said, don't ever think about, the lymphatic system for anxiety or depression because there's no lymph vessels in the brain. Well, that's changed. Now we know there are lymph vessels in the brain, and your glymphatic system that must clean your brain, and it does most of it at night, 90% of its cleaning at night, has to flow to your deep cervical lymph vessels. So when our lymph vessels here become clogged up, your neck becomes clogged up, and then your lymphatic system can't clean. And that's why we need to think about movement. It's about movement, right? We sit way too often. I don't know about you. We're researching, we're writing, we're seeing clients, we're sitting a lot. And we need to move, in between that.
And it's true that the lymphatic system is the only system that doesn't move on its own. Like, we have to move it.
Right, but when we stimulate it, right, it does have some spiral muscles around the bigger ducts. So when we stimulate it by exercising or even just deep breathing, that it will pump for a little while, those spiral muscles. Not for a long time, but they will work. That's why before bedtime, right, we want our brain to clean, or even our body to clean. Because once we open up these vessels, we're really helping whole body lymph flow. Most people go to bed, they just lie down, they just go to bed, they're exhausted, and their body is not going to clean well. If we can just do a little bit of movement, move your shoulders, which we'll talk about, take some deep breaths before you go to bed, stretch your arms overhead, just simple things. I did that. My legs are tingling right now. I feel flow in my arms, the back of my head. It doesn't take much. It just really takes having an awareness. That's my goal of doing these, podcasts, is to really make people aware, because most people, they never think of it.
Right. So we talked about the brain and the lymph. Let's talk about how the lymphatic, where does lymphatic health intersect with menopause?
Yeah, very big. A lot of research is coming out that, and menopause is normal. I don't want a lot of women yelling at me, it's not something that we can get rid of. We have to have it, but there are some countries that hardly have any experience of it, right? They don't even have a word for it. I believe it has to do with a lot of that acidity in our body. And when you're acidic, your body can't clean, and then you feel more waste. Some studies have come out with menopause saying that when you have an extreme case of menopause, it's about cellular waste building in your body. And a lot of that cellular waste is called senescent cells. And don't get, scared off by these names. Just think of it as a zombie cell. We all know about zombie games, and, these things that are alive, but they're really not alive. So a zombie senescent cell is a cell that no longer replicates. Our cells are meant to replicate. And when it can't replicate anymore, it should die and be taken up by autophagy or taken up by the body, by metabolism. Well, these cells don't get taken up. And they just sit around decaying, and they give off this component called SASP, which actually damages and kills the cells around it. And a lot of that happens because of cytokines. And cytokines are just immune cells. And we need immune cells in our body, these cytokines. But when we have excess of them is when we keep on creating inflammation and inflammation. We get in an inflammation loop. So we have to get the lymphatic system flowing to get rid of these senescent cells, not all of them, but get rid of the buildup of them. And then we start feeling better, right? We start feeling more normal, because most women say, I just don't feel like myself. And, you can feel like yourself. You just have to get a system in your body flowing, and then we do much better. And it's every organ. It's in every part of your body. We think of it as this linear drawing with lines, but it's inside your blood vessels, outside your blood vessels. It's inside your organs, outside your organs. It's through your fascia. Every muscle is not one big muscle. Every muscle is hundreds of strands of little fibrils of muscles, and each one of those little fibrils have blood vessels, lymph vessels, and nerves, and fascia around it. So they can become, one little bang or a problem, a trauma on a muscle can really damage it, and then it can spread into the whole muscle because of damaging the lymph system in that little muscle part.
So, buildup of acidity will trigger
Yeah.
worse menopause symptoms, or just like, have you seen it? If I'm just trying to think, like, say someone comes to my office and they're suffering like way more than the next person in my office with menopause symptoms, would I be thinking, oh, lymphatic system, maybe it's very, very stagnant, and compared to the other person that might not be having as many symptoms?
That's exactly it. The days like some people, hey, I'm feeling great today. I have no anxiety. I have no swelling in my face. I have no fatigue. Why is that? And then 2 days later, they're back in bed. They can't move. They're crippled. It's because sometimes we have these ups where we're less toxic. You go outside and you do a little bit more because you're feeling better. You go shopping, do some things in the yard, and that moves waste in your body. Because our waste is always building. The lymph system handles about 10% of the waste. Your veins pick up a lot of it, but about 10% of the cellular waste, acidic waste, parts of cells, gets trapped in your organs, in your bones, around your muscles and tissues when our lymphatic system cannot clear that waste. So it's that 10% that's always growing and growing when our lymphatic system is not flowing. And trust me, it's not flowing for most people. It's really scary that we don't understand this.
Yeah. So we talked about brain, menopause. How does a sluggish lymphatic system show up in digestion?
Yeah, well, I'm a poster boy for that. I had IBS for 30 years. I mean, and I thought it was normal because my whole family had some type of digestive issue, and I'm sure for most families it's like that. But it was bad. I was a New York City firefighter, and it was it was hard. But within a few weeks of maintaining my lymphatic system in a different way, I had a massage therapy clinic, actually two of them. I got massages. I trained my girls how to do lymphatic work. My therapist. I got therapy all the time. But it wasn't enough. I had to change my inner environment. I changed my diet for 30 days. I ate nothing, and I hate vegetables. I hated them then. I love them now, right? I ate nothing but cooked vegetables, like you would roast a chicken. I didn't even know to eat raw vegetables, which I tell people eat a little bit a few days a week. But it changed my life. Within a few weeks, I actually, what was happening with me, I had irritable bowel syndrome, lactose intolerance. I was starting to get worse, meaning I was even getting heart palpitations. That means you're getting worse, more acidic in your body and more protein filled. My hands and my back would just cramp. My hands would always cramp. I would drop things all the time, which means my central nervous system was getting bad. I was 70 pounds overweight. My hair was falling out. All these things were happening. And within 3 weeks, everything sort of started to resolve. It took me months to lose weight. My hair started coming back in months, but my IBS went away right away. My hands stopped cramping. I took control over inflammation in my body. And most people don't realize that inflammation is, we have this word, the root cause of disease is inflammation. But what is inflammation? It's what your lymphatic system is not picking up. It's the immune cells like cytokines that just keep on ramping and ramping and ramping and creating inflammation. So even though we talk about the MTHFR gene, the detox pathways that don't work, to me, it's really your lymphatic system. Because we don't acknowledge the lymphatic system in naturopathy, we do. You guys do a lot, but in traditional medicine, I've experienced this. I've gone to the doctors when I had bleeding from my tongue, and they checked I had cancer, and they checked it. The best doctors, no, we don't see anything. I'm like, okay, then I'm going to drain it. It kept on bleeding my tongue, and I just drained it for days. And it never came back. I rerouted my lymphatic system. It had a dysfunction. And it still has not come back. It's been decades. So we have to reroute this system. It's a plumbing system. It's like gets blocked very easily from our own waste, inactivity, fats, and we need to give it a little bit of push to get it going sometimes. And even just deep breathing can make a big difference.
Yeah. So this is probably a new topic for most everyone listening, hearing about the lymphatic system. So what are some early signs that someone's system might be compromised and they don't even know it, besides some of the things that we already talked about?
Yeah, to me, it's everything. Do you bloat?
Yeah,
do you get eczema? Do you get acne? Do you get sinus problems? Sinus problems are rampant, right? When we clog up here, then waste can't sort of get down out of the sinuses. And it builds up and it makes your sinus tissues more acidic. And now they can't flow. And they just tend to get worse and worse and worse. And we don't want to have sinus issues because we recently found nasopharyngeal lymphatics right behind the nose. And those lymphatics drain your sinuses, they help your eyes, even your ears, but they drain your brain, they found. So if you have sinus problems, you may not be cleaning your brain as well. And that's where we may get later signs of brain fog or dementia and stuff. So it's really about clearing that waste.
So what do we do, Lymph Man? I know that there's, you can do vibration plates, you can do lymphatic massages. Some people, I'm pretty sure we need to do stuff on a daily basis, maybe multiple times a day. So what are some good things in a good practice that people can add into their daily routine?
We'll go over a few things. On Instagram, people should follow me. I just get on almost every day and I go, hey, here's some new science about the lymph system, but let's do the Lymph Man shoulder shuffle. It may seem repetitive, but I believe it's life-changing, right? Because I have people who say, John, I've been doing this for a couple of weeks. I have no more allergies. My headaches are gone. I just feel totally different, right? All they did was move their lymph system, and it doesn't happen overnight, right? And actually, when we first start moving our lymph system, when we start changing our diet, doing exercise, or draining ourselves, or getting a massage, a lymphatic drainage session, you may feel a little icky because we're actively pulling waste out of the tissues.
Yeah.
Even when you start supplements, some people, and you guys deal with a lot of supplements, sometimes people start taking supplements and they'll say, oh, I can't take that supplement anymore. It made me feel sick. Well, most probably it just was releasing waste, what made you more toxic, so it was actually a positive sign. And that's what I try and tell people. When you do the shoulder shuffle, when you deep breathe, you start doing exercise or taking some supplements, or seeing a doc like yourself, and you feel a little ill, see that as a positive. Say, wow. Of course, talk to the doctor about it. But to me, it always clears. It always clears. By the next day, you feel better. And I'll give you a little example of what I did in my office, and then we'll go over a few things. When I had realized, and I had met this doctor from the 1990s. He had read a book, Beyond Pritikin. He was a co-author, and he was sick. He was in his 70s, and he came to see me, and he flowed. I was like, how do you flow? Nobody else flows. And he explained that when in the 70s, naturopathic doctors were doing studies on food, and they were realizing that if you got your pH to a 7.2, and they were just dealing with saliva, that's all they really dealt with. He says, we saw that people started getting better. But he said, when we realized that, Nixon declared war on cancer, and that night, all research dried up on pH and went to drugs. I mean, that's from a man who was in the industry, right? So what would have happened if we, 30, 40 years ago, realized that we have to change our diet and change our inner environment? And how we can do it is, let's start with posture, right? We did sitting up straight, shoulders back, head back, right, chest out. I mean, you just feel a difference. If you've been slouching and you feel tightness in your back, that's acid waste building in your lungs and around your shoulder. When you sit up straighter, you feel things start to move and you feel more open and flowing. The next thing is a deep breath. Most people don't deep breathe. We need to deep breathe. What I tell the clinicians, people who sit for a living, like psychologists, and between each client, do some deep breathing, because otherwise you're sitting, listening, and hardly even breathing, because when you concentrate on things, we don't tend to breathe much. So when we deep breathe, and what we want to do is just take a deep breath in. I like to do it through my nose because it pulls through my head more. If you have nasal problems, you will still want to try and breathe through your nose, because if you never breathe through your nose, you're never going to clear that acidity in there by pulling waste through it. And then we blow it out with a big exhale. So a deep breath in, after you get good posture, it goes, and blow it out. I mean, blow it out really hard. That blowing out makes a wave through your body. You can actually feel it, a little bit of a wave. So you take a deep breath in and blow it out. I mean, you do about 5 of those, you feel a difference in your body. The third thing we can do is the Lymph Man shoulder shuffle. I picked Lymph Man because it's much easier than the Ossipinsky shoulder shuffle, right? So Lymph Man's a lot easier. So what we do is we sit up straight again, because if we slouch and do it, and trust me, if you're on a computer all day long and you just go even just a little bit down like that, you're slowing or stopping your lymphatic system. So be very aware of it. Put signs by your computer, sit up straight, take some deep breaths, do the shuffle. And what we're going to do is I put my hands on my lap. It's easier when you're sitting, but you can do it during while you're standing or walking. The other day, Eileen, my wife, videoed me while I was doing it through Home Depot. I was tight, so I was walking around looking for things, but I was doing my shoulder shuffle, right? We can't go around draining ourselves all the time, but you can do the shoulder shuffle in a matter of 10 seconds and improve your health and feel better. So put your hands on your lap and just put one shoulder up, and then it comes down and the other shoulder goes up. So one up, one down. right? So if you have any neck pain, any neck surgeries, we do this nice and easy. And already I'm getting tingles in the back of my neck, in my legs, so it's affecting my whole body. And then now, if you have no pain, let's really rock it, right? Let's really do it. Let's really do it really fast. Even go up a little higher to your ears. Yeah, there you go. Oh man, that feels good. How does that feel?
It's good.
Feels good, right? Yeah. And we don't want to do this. This does not do it. It does, because
Well, that
when
felt
we do,
good too. Sorry.
yeah, it feels good, but it's not moving the two vessels. We actually want to
Okay.
shift those two
Just
vessels to
straight up
get
and
the
down.
acid straight up and down. Again, you can do the other one too, but this is what opens up your lymphatic system. And I'll tell you, I always tell people, start teaching your children at the age of 5. Right? I've said that for decades. Well, I'm a new grandfather. I have a 14-month-old granddaughter.
Congrats.
And she's been, me and my wife, once in a while, we've been starting to do the Lymph Man shoulder shuffle around her, just doing this. And she would just laugh for a while. Just laugh at us hysterically. And now when I do it, after a minute of looking at me, she goes, she tries to do it. So she's 14 months old. So I'm hoping that a couple more months, she's going to know how to do that shoulder shuffle. And I believe if we can teach our children early enough to keep the lymph system going, we could have a better chance. It's just an edge, right, of not having anxiety, not having depression, maybe not getting cancer, because disease has been found to be from lymphatic dysfunction, which is an obstruction. And we can open it up with the 3 things that I just talked about. But there's so much more to know. In my courses, I teach how to drain the mouth, the eyes. You'll feel it around your brain, the breast, every part of the body. But it's just something I really think we need to start incorporating into any health problem. And then we start doing much better.
Yeah, I don't know if you read any of my history, but I had non-Hodgkin's lymphoma. So I had a lymphatic cancer and a tumor by my bladder.
Yeah, well, thank God you're doing better, right?
Yeah.
You know, and thank God you were more naturopathic, right?
Well, that's how that's how I got into this profession. Yeah.
Good for you, right? You had a good experience and you want to help other people. Yeah. It's beautiful.
Yep. Love the lymph system. So I'm sure we could wrap on this for so much longer, but we'll wrap it up with a question I ask all of my guests. What is your best or favorite health tip that you can share with the audience?
You know, my favorite one, I'll tell you the truth, because I think the Lymph Man shoulder shuffle is important, but if we don't have our body being more alkaline, so magnesium, and I'm sure you believe in that too. Magnesium is key. You know, we need to have enough of it, and most people just take some at nighttime to sleep better. But what happens if we take it a few times during the day, right? You just don't want to, if you take too much, you'll get a little loose bowel, you back off a little bit. But when you take enough magnesium in your body, you feel more relaxed. You feel more flow through your body. Just know, like anything else, when you start taking a supplement, you may feel a little bit of a detox reaction. It should pass, right, in a little while, in a couple hours to a day. But it really, magnesium to me is key. We get it in our food. We definitely get it in our food when we eat more fruits and vegetables, which I love now. But I think we should still supplement with magnesium. And I like magnesium glycinate. Sorry, I'm from Brooklyn. I talk different. But because the magnesium and with glycine, you're putting 2 things together, magnesium and glycinate. And glycinate has been showing a lot of promise for stalling or stopping a lot of the age-related problems we have.
I don't think anyone's ever said magnesium, or actually just like the alkaline part.
Yeah, no, acid alkaline is really, I first learned about it maybe 20 years ago. I was walking through a health food store and somebody said, here, and he tested me and he says, you're acidic. And I said, yeah, okay, great. Who isn't? But I didn't realize the importance. 10 years later, I realized that it's basically creating most of our health problems because it's stopping our lymphatic system. So we have to know, are we in balance or out of balance? And that's where you know, we can check pH in our body. And it's just a test. It's not something perfect or accurate completely. It's just an idea. But most people will feel, if you're feeling a little bit of bloating, if you're feeling a little fatigue, that's the biggest thing that people feel is fatigue, then you know, you're probably a little bit acidic in your body, and we're just not realizing the effect it can have on our blood vessels, our lymph vessels, and our organs. Because even your organs, if they get acidic, will constrict a little bit and not have the proper circulation.
Right. Great advice. Well, Lymph Man, this has been wonderful. He has a website, healthylymphsystem.com. He also has a podcast, The Lymph Brain Revolution. You could also find him on johnossipinsky.com/lymphbrainrevolution. He's on Instagram and Facebook at The Lymph Man. So we'll have all of this linked in the show notes. Is there anything else that you wanted to add as we wrap this up?
No, I think we had a great conversation. Hopefully we educated some people to do the shoulder shuffle so they can
Yeah.
flow and get their supplements. That's the big thing, is the lymph system has to complete circulation. We don't think about that. It has to complete circulation. So if we're not flowing here, then maybe, or in some part of your body, maybe they're not getting the supplements that you're spending,
Right.
some money on. We want to get our
Just stuck.
supplements going into our organs or where we need them, and we do that by completing circulation with the lymphatic system.
Awesome, John. Well, thank you
All
so
right.
much for being on the show. Yeah,
I
we'll see everyone
appreciate you.
again
You have
next
a good
week.
day.
Thanks. Take care.
Bye.